Freiberg's disease. What is Freiberg's disease? Freiberg's disease is also commonly known as Freiberg's infraction, which means incomplete fracture, or Freiberg's infarction, which means necrosis or bone death due to obstruction of circulation. In any event, the condition is a result of avascular necrosis, meaning the blood supply to the affected bone has been cut off, causing the bone to undergo changes, usually resulting in pain. The disease can vary in severity and usually gets worse as time goes on. It usually begins in the second decade of life, however, may not manifest itself as pain until the patient reaches their early 20s. It is far more common in females than males. This disruption of circulation is thought to occur primarily from repetitive stress, such as running or wearing high heel shoes, and not necessarily one incidence of trauma. The repeated stress to the growth plate of the bone causes microfractures in the growth plate, which eventually lead to a disruption of the blood supply to that area of the bone. Typically, the patient complains of localized pain in the ball of the foot near the bone that is affected. There may also be limitation of motion of the affected toe. The pain is usually exacerbated by excessive activity and can worsen overall with time. An X-ray reveals the classic flattening of metatarsal head. There can also be fracture and fragmenting of the bone, resulting in loose bodies of bone in the area, causing further pain. All of this leads to degeneration of the joint between the metatarsal bone and toe. Treatment of Freiberg's disease. The treatment of Freiberg's disease is dependent on the amount of bone destruction and the amount of pain the patient is experiencing. Conservative treatment. In the younger patient who is in the early stages of bone destruction, the acute stage, it may be appropriate to try a non-weight-bearing cast for a minimum of 4 weeks in an effort to prevent further bone and joint destruction. Some patients will do fine with a walking cast or even a stiff-soled shoe. The problem here becomes one of patient compliance, as it is very easy to cheat and not wear the shoe or cast all the time. Anti-inflammatory medication may be given in conjunction with the cast to reduce symptoms. After the patient is clinically healed, they should limit themselves to very conservative, stiff-shanked shoes to limit the bending at the ball of the foot. An orthotic may also provide protection as well. Generally, the orthotic should have a metatarsal bar built in to take pressure off the head of the bone. High heels are definitely out of the question, as is athletic endeavors. Patient compliance is a must in these situations, because if the disease cannot be quieted down, there will be further damage to the metatarsal bone, resulting in chronic pain. Surgical treatment. In those situations where conservative measures have failed, surgery becomes a viable option. An MRI of the bone and joint should be performed prior to any surgical procedure in order to get a clear picture of the diseased joint, to see if there are any loose bone fragments in the joint, and to check the overall bone stock or quality of the metatarsal bone. Surgical procedures. Cleaning out the diseased joint of bone spicules, bone spurs, and to remove actual loose bone bodies floating around the joint. Drilling holes into the metatarsal head in an effort to increase circulation to the head of the metatarsal. Partial metatarsal head resection, where a portion of the metatarsal head is removed. Dorsiflectory wedge osteotomy, where the head of the metatarsal bone is actually elevated up slightly by cutting into the top portion of the bone. This removes some of the pressure on the head of the bone. Even though lesser metatarsal implants exist, at this writing, there is not a general consensus that they are effective in treating Freiberg's disease. Read the complete article at www.foot-pain-explained.com/Freiberg.html